everyone must continue to fight COVID-19. Low potential for COVID-19 reinfection. Good afternoon, thanks for joining us, and you're watching Updates at Noon. I'm Jessica Lee. Prime Minister Tan Sri Muhyiddin Yassin has called on every Malaysian to stay united in fighting COVID-19 as the pandemic is far from over. Now, he said if everyone manages to overcome this challenge, the spread of the pandemic could be contained with the mercy of God.
Let me remind you that the war on COVID-19 is not yet over. The fight is still on. We are doing well so far. We just uplift your spirit and continue to fight. If we persevere, inshallah, we will win.
In his special message to the people yesterday, the Premier also praised the people for the increased level of Movement Control Order or MCO compliance, which has now reached 97%. He said the level of MCO compliance in the country is high, and this shows that everyone understands the importance of personal health and safety. While announcing that the government has decided to extend the MCO for another 2 weeks until the 28th of April, the Prime Minister said every Malaysian would enter a new normal phase of life where they will no longer be able to do what they were used to do, including offering a simple handshake. Apart from that, he said the people will also have to get used to frequently washing their hands with soap or hand sanitizer and using a face mask to contain the spread of COVID-19. Now, the Cabinet has decided to allow several additional economic sectors to operate in phases during the Movement Control Order or MCO, which has been extended until the 28th of April on condition of strict adherence to health and safety guidelines. The Ministry of International Trade and Industry or MITI said other industries that are allowed to operate are machinery and equipment, aerospace and science, professional and technical services, including research and development, R&D related to legal practice, oil and gas, and activities related to COVID-19. In a statement release, it said registered traditional medicine services, hardware shops, electrical and electronic shops, optometrist shops, barber shops and full-service laundry shops are also allowed to operate. Its Minister, Datuk Sri Muhammad Azmin Ali, said companies in the additional sectors listed may submit their application to MITI beginning Monday from 9 a.m. All applications must be made online at www.miti.gov.my, and only applications that are complete will be processed. Besides adhering to these enhanced terms and guidelines, operating permits are also subject to compliance with the requirements set by the Ministry of Health, MOH, and guidelines by other relevant enforcement agencies from time to time. The Minister also said failure to comply will result in immediate revocation of the operating permit and legal action taken on the offenders. MITI has reviewed the additional sectors that are allowed to operate based on importance in the global value chain or GVC and the country's exports. The additional economic sectors allowed also have high value-added multiplier, giving impact on the sustainability of SMEs in the economy, particularly in manufacturing and services, as well as size of workforce involved. The potential for fully recovered and discharged COVID-19 patients to be reinfected is very low. Health Director General Dr. Nur Hisham Abdullah said although the possibility of reinfection was low, patients would be given counselling before being allowed home and recommended to always practice social distancing, take care of personal hygiene, as well as avoid from going to public places.
Mereka boleh dijangkiti kembali. Walaupun biasa dia kita lihat mereka adalah walaupun dah dikesan antigen tu negatif, ada kalanya antibody tu tak cukup. Dia ada antibody tapi tak cukup untuk mereka kalau dijangkiti semula. Jadi the antibody is not protective yet.
So far, a total of 1,830 people, or 42.11% of COVID-19 patients, have fully recovered and discharged, and this is more than the number of new cases reported. Datuk Dr. Nur Hisham said the ministry would always monitor the condition of patients declared free of the virus and carry out follow-up treatment to ensure that infection cases did not recur. Meanwhile, he said the ministry was studying and identifying the effectiveness of several test kits in terms of getting fast and accurate test results.
Kalau kita dapat laksanakan satu ujian COVID-19 ni dalam tempoh masa setengah jam ataupun 1 jam, itu adalah paling baik. Tetapi setakat ni kita tak jumpa lagi ujian rapid test kit yang dapat berkesan dengan ketepatan yang tinggi.
Datuk Dr. Nur Hisham said the ministry will conduct clinical trials on the test kits from South Korea soon to ensure the effectiveness of the equipment. In another development, Datuk Dr. Nur Hisham said the Health Ministry is looking forward to collaborating with China on COVID-19 research. He added that both countries can share a lot of testing techniques on COVID-19.
And research means today we are looking at the virus. Can we isolate that virus? Now, if we can isolate the virus and we can do the whole genomic sequence now, then we can actually identify the virus. So we ask ourselves, because this is a new virus, so nobody have the identification of this virus. Are we seeing this virus from Europe, from China? We don't know.
The Chinese medical team is expected to arrive in Malaysia in 2 weeks' time to share their experience in handling the COVID-19 outbreak in their country. Datuk Dr. Nur Hisham said basically the medical team from China would like to look at Malaysian hospitals' performance in handling COVID-19. The current COVID-19 outbreak does not discriminate between social classes. Senior Minister Datuk Seri Ismail Sabri Yaakob said this to those who were rude and refused to cooperate with the medical staff involved in handling the pandemic. The senior minister stressed that social class or position does not guarantee that they would be safe from the virus.
Dan saya haraplah mereka yang berkedudukan tinggi itu sepatutnya lebih bertamadun daripada orang lain. Jadi saya harap berikanlah kerjasama kepada petugas-petugas frontliners ini, terutamanya doktor, nurses dan sebagainya yang terlibat. Kerana seperti saya katakan, kedudukan yang tinggi tidak menjamin mereka terselamat daripada COVID-19.
Datuk Seri Ismail Sabri said this in response to concerns raised by several doctors and nurses on duty who were called names and treated poorly by Malaysians who returned from overseas. Asked on what action could be taken against the group, he said laws related to preventing civil servants from carrying out their duties could be applied on the issue. Now, on another note, the senior minister said the 1,000 ringgit compound may not be deterrent enough as many are still ignoring the MCO. Hence, he said the government might ask the Health Ministry to discuss with the Attorney General on the possibility to raise the fine or jail sentence imposed on those who violated the order.
Kalau kita lihat di luar negara, di Singapura misalnya, mulai 17 April, hukuman pesalah pertama adalah 10,000 Singapore dolar. Kesalahan kedua 20,000 Singapore dolar. Di Korea Selatan, kesalahan pertama sekalipun 35,000 ringgit Malaysia. Begitu juga di negara-negara lain. Di Indonesia pun, tak silap saya, 300 juta rupiah. Jadi hukumannya adalah besar dari segi yang ditetapkan adalah tinggi, iaitu melebihi daripada 10,000.
Currently, those who breach the MCO will be charged under Rule 6 and 11, Subsection 1 of Prevention and Control of Infectious Diseases, Measures Within the Infected Local Areas Regulation 2020, which carries a maximum 6 months jail sentence or a maximum fine of 1,000 ringgit or both. The Malaysian Armed Forces, or MAF, will strengthen and tighten the country's border control during the Movement Control Order, or MCO. The Chief of Defence Force, General Tan Sri Effendi Buang, said MAF would always take various factors into consideration in drafting the country's strategic defence plans to cover any situation, especially since the country is facing the COVID-19 pandemic. In a statement released, General Tan Sri Effendi said they even looked into various possibilities, especially in anticipating the action of foreigners entering Malaysia illegally by using red lanes. He said while the MCO and enhanced MCO are being implemented, domestic operations will continue as usual. He also said that MAF is collaborating with the Royal Malaysia Police, especially the General Operations Force, as well as other security agencies, to not only carry out border controls in Peninsular Malaysia and East Malaysia, but also the nation's maritime borders. General Tan Sri Effendi further noted that with the latest directive as contained in Prime Minister Tan Sri Muhyiddin Yassin's special message, MAF would further strengthen every land, sea and air control to be at the highest level. Now, as the provider of essential services in the area of electricity, Tenaga Nasional Berhad (TNB) is going the extra mile to provide comfort to the police and military personnel manning temporary security posts set up to enforce the Movement Control Order, or MCO, by illuminating posts without proper lighting. Now, the utility company has been striving to provide the best service to the people and is fully cognizant that several locations of the temporary security posts in the peninsula require proper lighting. When contacted by RTM, the Energy and Natural Resources Minister, Datuk Dr. Shamsul Anwar Nasara, said this initiative has provided convenience and improved the safety of the police and military personnel who are on night duty.
Saya dimaklumkan oleh Tenaga Nasional Berhad, setakat ini hampir 120 lokasi pos kawalan telah pun menikmati kemudahan ini yang disediakan oleh Tenaga Nasional Berhad, dan TNB akan terus mengepasi lokasi-lokasi lain yang memerlukan kemudahan ini. Jadi inisiatif ini adalah sebahagian daripada program CSR TNB, dan sebenarnya saya nak maklumkan bahawa Tenaga Nasional Berhad tidak mengenakan sembarang cas.
Among security posts that have been illuminated include posts in Bentong and Temerloh in Pahang, as well as in Kulai, Pontian and Kluang in Johor. Police arrested 6 people believed to be family members and seized various types of drugs worth 3.5 million ringgit during a raid at a house in Tanjung Karang, Kuala Selangor. Bukit Aman Narcotics Criminal Investigation Department Director Datuk Ramli Din said those arrested were 3 women aged between 36 and 64, with 2 of them believed to be sisters. Commenting further, Datuk Ramli said 3 others arrested were below the age of 18. On the drug seizure, he said it included 61 kilograms of shabu in 51 plastic packages, which were found in 4 white sacks, and 11.65 kilograms of pills believed to be Aramin 5 in 4 packages.
Keseluruhan dadah ini boleh digunakan oleh 360,000 orang pengguna. 360,000 orang pengguna dan jumlah nilai dadah yang dirampas ini merupakan 3.5 juta nilai di pasaran sekarang ini. So di zaman ataupun musim PKP inilah yang kita rampas yang paling besar.
The police are now looking for a man identified as Azam Muhammad Tasik with identity card number 900903-01-6577 to assist in investigations. In another development, Datuk Ramli said a total of 1,502 individuals had been arrested for drug-related offences at roadblocks mounted nationwide following the enforcement of the Movement Control Order, or MCO. He said of the total, 109 individuals were detained for suspected drug trafficking, adding that the tactics used by the suspects to smuggle the drugs during MCO, among others, include using food delivery services, tow trucks and hearse. WHO warns of deadly resurgence if COVID-19 controls lifted too soon. That and more coming up in our foreign segment. Now, Yemen reported its first case of COVID-19 on Friday in a southern government-controlled province, raising fears of an outbreak in the war-torn country as airstrikes blamed on the Saudi-led coalition tested a unilateral truce. The announcement came on the second day of the 2-week ceasefire declared by the military coalition supporting the government in what it said was a move to help fight the pandemic. Yemen's Supreme National Emergency Committee for COVID-19 through Twitter said the first confirmed case of coronavirus has been reported in Hyderabad province. The committee, run by the internationally recognized government of President Abir Rabut Mansur Hadi, said the infected patient is in stable condition and receiving care. World Health Organization, meanwhile, said the case is in isolation and treatment. All known contacts are being traced and quarantined. 8 groups have warned that when COVID-19 hits Yemen's broken healthcare system, the impact is likely to be catastrophic for a country already in the grip of what the United Nations calls the world's worst humanitarian crisis. Now, the World Health Organization warned that a hasty lifting of restrictions imposed to control the COVID-19 pandemic could lead to a fatal resurgence of the virus. WHO Chief Tedros Adhanom Ghebreyesus said it was working with countries on ways in which lockdowns could be gradually eased, but said doing so too quickly could be dangerous.
WHO wants to see restrictions lifted
as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence. The way down can be as dangerous as the way up if not managed properly. WHO is working with affected countries on strategies for gradually and safely easing restrictions.
According to an AFP tally, more than 1.6 million infections have been recorded globally since the virus first emerged in China in December. Tedros welcomed signs that the spread of the virus is slowing in some of the hardest hit countries in Europe, namely Spain, Italy, Germany and France. But he also warned of an alarming acceleration of the virus in some countries, highlighting Africa, where he said the virus was beginning to spread to rural areas. The Spanish government said the country has recorded its lowest daily death toll from the COVID-19 virus in 17 days, with 605 people dying on Friday. The update raised the overall number of fatalities to 15,843 in Spain, which has suffered one of the worst outbreaks of COVID-19 in the world, and where the total number of confirmed cases now stands at 157,022. The figures showed the death rate is slowing to 4%, down from just under 4% on Thursday, in line with the trend which began on the 25th of March, when it stood at over 27%. The rate of infection also slowed, with 4,576 new cases over the past 24 hours, while the number of people who recovered from the virus rose to 55,688. Although health chiefs say the pandemic has peaked, they have urged the populations to pay strict attention to the ongoing national lockdown, which was put in place on the 14th of March in order to slow the spread of the virus. The restrictions will remain in place until the 25th of April, although the government has made it clear it expects to announce another 2-week extension. The UK government says people can buy whatever they want from shops that remain open amid concerns some police are overstepping lockdown powers. Now, there have been cases of police warning shoppers against buying non-essential items. The British Prime Minister's official spokesperson said people can use their gardens as they wish after a video showed police confronting a family for letting their children play outside. Meanwhile, the British Premier has been up and walking as his recovery continues. Downing Street said Boris Johnson, who was discharged from intensive care to a hospital ward on Thursday night, has been able to do short walks between periods of rest as part of the care he is receiving to aid his recovery. The spokesman said Johnson had spoken to his doctors and thanked the whole clinical team for the incredible care he has received. The number of people who have died in UK hospitals after testing positive for coronavirus has now reached 8,958, a record increase of 980 on Thursday. The government is seeking to reassure the public about the lockdown rules as it stresses the measures are working to reduce the spread of infection and the number of people admitted to hospitals. Brazil's health ministry said that the hardest hit Latin American country in the COVID-19 pandemic passed the mark of 1,000 deaths on Friday. The ministry's latest figures gave a toll of 19,638 confirmed COVID-19 cases, with 1,056 deaths, one fewer than it had indicated in an initial tally earlier in the day. With a worldwide death toll of more than 100,000, Brazil's figure is still relatively small compared to the number of deaths in countries such as Italy, the United States and Spain. But health officials are bracing for things to get worse as experts predict that the outbreak will only start to peak in Brazil towards late April. There are fears for what that could mean in the country's poorest areas, especially in the favelas. Crowded, impoverished slums in cities such as Sao Paulo and Rio de Janeiro that typically lack basic health and sanitation infrastructure. President Jair Bolsonaro, meanwhile, faces a firestorm of criticism for downplaying COVID-19, calling it a little flu, and the reaction to it hysteria. The far-right leader has clashed with local and state authorities over their decisions to close non-essential businesses and tell people to remain home, which he says is needlessly wrecking the economy. Coming up in sport, FIFA says it would be irresponsible to prematurely restart football amid COVID-19 crisis. Now, FIFA President Gianni Infantino on Friday said that no match is worth risking a single human life, and that World Football's governing body would be able to help financially national federations during the COVID-19 pandemic. Now, the majority of top football leagues and international competitions have been suspended due to the COVID-19 outbreak, and Infantino insisted that games would not resume until it was safe.
On our first priority, our principle, the one we will use for our competitions and encourage everyone to follow, is that health comes first. I cannot stress this enough. No match, no competition, no league is worth risking a single human life. More than irresponsible.
Infantino said that national football associations, which are struggling financially, would receive help from FIFA's Emergency Relief Fund. He said the football governing body is currently in a very strong financial situation, and it is important and duty to provide assistance to those in need. FIFA last week postponed all international matches scheduled for June.
We must think what we can more than irresponsible.
Now, Liverpool legend Sir Kenny Dalglish has tested positive for COVID-19 and is in hospital but is showing no symptoms, his family have announced. Dalglish was admitted to hospital on Wednesday for treatment of an infection which required intravenous antibiotics. The 69-year-old former Celtic and Scotland forward has routinely tested for COVID-19 after being admitted. Sir Kenny won the Scottish League title 4 times at Celtic before moving to Liverpool in 1977. At Liverpool, his honours include 8 league championships as a player and manager and 3 European Cups. He also won the Premier League as Blackburn Rovers manager in 1995. In a statement released by the Dalglish family, the Liverpool legend thanked the brilliant National Health Service staff whose dedication, bravery and sacrifice should be the focus of the nation's attention at this extraordinary time. Prior to his admission to hospital, Sir Kenny had chosen to voluntarily self-isolate for longer than the advised period together with his family and urged everyone to follow the relevant government and expert guidance in the days and weeks ahead. And that's it from us at this afternoon's news. In our top story, everyone must continue to fight COVID-19. Before we go, we at the English desk would like to remind everyone to wash your hands regularly, practice social distancing, and most of all, let's adhere to the movement control order and just stay at home. Now join us again at 7 p.m. for more updates on the latest happenings around the world. Have a blessed Easter weekend. I'm Jessica Lee.